discussing an important topic today, which is the Glasgow Coma Scale or the GCS. It is an assessment used for patient having a rapid deterioration of nervous system. It allows healthcare professionals to consistently evaluate the level of consciousness of a patient. It is commonly used in the context of head trauma. There are three aspects of behavior that are independently measured as part of an assessment of a patient's GCS, which are the eye opening, verbal response, and motor response. The highest possible score is 15, which means the patient is fully conscious, and the lowest possible score is 3, which means the patient is in a coma. For the eye opening, a maximum possible score of 4 points. To assess eye response, initially observe if the patient is opening their eyes spontaneously. If the patient is opening their eyes spontaneously, then the patient scoring is 4 points. Next, eyes opening to verbal command. If the patient doesn't open their eyes spontaneously, you need to speak to the patient, such as, "Hey ma'am, are you okay?" If the patient's eyes open in response to the sound of your voice, then they score 3 points. If the patient doesn't open their eyes in response to verbal command, we need to move to assessing eye opening to pain. There are different ways of assessing response to pain, but the most common are applying pressure to one of the patient's fingertips, or squeezing one of the patient's trapezius muscles known as the trapezius squeeze, or applying pressure to the patient's supraorbital notch. If the patients open in response to a painful stimulus, then they score 2 points. If the patient does not open their eyes to a painful stimulus, no response, or they score 1 point. For the verbal response, a maximum possible score of 5 points. Assessing a patient's verbal response initially involves trying to engage the patient in conversation and assess if they are oriented. We should score the patient based on the highest scoring response they demonstrate during the assessment. Some of the common questions we can ask to help assess might include, "Ma'am, sir, can you tell me your name? Do you know where you are at the moment? Do you know what the date is today?" If the patient is able to answer the questions appropriately, then the assessment of verbal response is complete with the patient scoring 5 points. Next, if the patient is able to reply but their responses doesn't seem quite right, means they don't know where they are or what the date is, this would be classed as confused conversation, and they would score 4 points. Next, if the patient responds with seemingly random words that are completely unrelated to the question you asked, this would be classified as inappropriate words, and they would score 3 points. Next, if the patient is making sounds rather than speaking words, or groans or gibberish words, then this would be classed as incoherent, with the patient scoring 2 points. And lastly, if the patient has no response to your questions, then they would score 1 point. For the motor response, a maximum possible score of 6 points. The final part of the Glasgow Coma Scale assessment involves assessing a patient's motor response. We should score the patient based on the highest scoring response we were able to elicit in any single limb. For the obvious verbal command, ask the patient to perform a 2-part request such as, "Ma'am, can you lift your right arm off the bed?" or "Can you make a fist?" If they are able to follow this command correctly, then they would score 6 points and the assessment would be over. Next, localizes pain. This assessment involves applying a painful stimulus and observing the patient for a response. There are different ways of assessing response to pain, but the most common are: first, squeezing one of the patient trapezius muscles, known as trapezius squeeze, and applying pressure to the patient's supraorbital notch. If the patient makes attempts to reach towards the site at which you are applying a painful stimulus, or the head or the neck, and brings their hand over their clavicle, this would be classified as localizing to pain, with the patient scoring 5 points. Next, withdraw from pain. This is another possible response to a painful stimulus, which involves the patient trying to withdraw from the pain, such as the patient tries to pull their arm away from you when applying a painful stimulus to their fingertip. This is also referred to as normal flexion response, as the patient typically reflexes their arm rapidly at their elbow to move away from the painful stimulus. Withdrawal to pain scores 4 points on the Glasgow Coma scale. Next, for deflection response to pain, it is typically involves adduction of the arm or internal rotation of the shoulder, flexion of the elbow, pronation of the forearm, and wrist flexion. It is also known as decorticate posturing. It may be the significant damage to areas including the cerebral hemispheres, the internal capsule, and the thalamus. It scores 3 points on the Glasgow Coma scale. Next, extension to a painful stimulus. It is also known as decerebrate posturing. The head is extended with the arms and legs also extended and internally rotated. The patient appears rigid with their teeth clenched. The signs can be just one side of the body or on both sides. It indicates brainstem damage or also compression in the midbrain and lesions in the cerebellum. This extension response scores 2 points. And lastly, the complete absence of a motor response to a painful stimulus scores 1 point. That's all. Thank you for listening.